Imagine having surgery to remove a tumor in your brain. Then imagine being awake for much of the procedure so that surgeons can safely navigate around the area in your brain that controls speech. San Diegan Krista McFadden just went through this procedure at UCSD's Thornton Hospital, and KPBS health reporter Kenny Goldberg was in the operating room and offers us a glimpse at what's called awake brain surgery. Some of the images you're about to see are graphic.
For someone who's about to have brain surgery, Krista McFadden seems pretty relaxed. Today, surgeons will try to remove a tumor in her left temporal lobe. One by one, the doctors who will be in the operating room with her stop by to explain what they'll be doing. Chief neurosurgeon Bob Carter will perform the surgery. Neuropsychologist Mark Norman will also play a key role.
We're going to wake you up during the surgery. And during that time, you're going to see me in there, and I'm going to be talking to you. Okay. So I'm going to ask you to do a few things with me. One thing, I'm just going to ask you some questions about yourself. I may ask you to remember some things. And what we're going to try to do is we're going to try to elicit some information from you so that we can kind of map out where things are going on in your brain. Okay? Because we want to know the areas that are working really well, and we want to know the areas that may not be working, because those are good points for us to be able to help you.
Neurologist Jeff Gertsch will also be on hand.
There will be a little wand that is touched to various parts of your brain. You won't feel that, but it's just to make sure that when we apply electricity to your brain, it disrupts the tissue just for a brief period of time. Make sure that we see that nothing in your language or anything gets disrupted. Okay. And that's very important, because that would mean don't touch that.
Krista and her husband Clay say their goodbyes before she's wheeled into the operating room. Once inside, Krista is put to sleep while surgeons remove part of her skull and make the incision into her brain.
So we're just waiting for Krista to wake up after the sedation that was given for the opening. So this is the incision that you see here, and the surface of the temporal lobe and the frontal lobe. And then we've got a little electrode that we've put in for monitoring for seizures during the part where she comes awake.
Once Krista wakes up, the team begins testing areas of her brain close to the tumor.
We're going to stimulate some of the tissue in order to determine what is viable tissue that we may not want to touch and which tissue can be safely resected.
As surgeons stimulate Krista's brain with a small electrical current, Dr. Norman has her say a few words. He's looking for any indications that her speech functions are being disrupted. At the same time, Dr. Gertsch takes a look at an EEG showing Krista's brain waves. He's watching for signs of a seizure or any other unusual activity. Carter thinks it's safe to proceed, so he starts to cut into the tumor. Staff from the pathology lab come by to take a sample of the tumor. The pathologist will determine whether the tumor is malignant. That will help decide what kind of treatment Krista might need after the surgery. Periodically, Gertsch checks in with Krista.
Yeah, you feel me touching your arm, okay?
Yeah.
Squeeze my fingers tight and strong. Pull me in towards you like a curl. Good.
Before Carter removes more of the tumor, he wants to make sure he's not cutting into any part of the brain that could affect Krista's speech.
Hey Krista, can you count to 10 for us?
1, 2, 3, 4, 5, 6, 7.
You're arrested? Okay, that's an arrest.
Carter probes the same area again, and Krista falters once more.
Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday.
I was very happy to get that positive test of where her speech arrest was, because that tells us exactly where that is, and we can stay away from that area.
As Carter finishes cutting out the tumor, he double-checks his work by looking at a 3D image of Krista's brain. Finally, Carter is satisfied.
We know that we've gotten a good resection of this lesion anatomically, and we'll be able to stop our operation. And there'll be a little uncertainty over the next several days as we get the final results back, but we don't think this is any kind of malignant or cancerous lesion, which is good news for the patient.
You did such a great job. You're all done. Next time you wake up, you're going to be probably in the recovery area, okay?
When everything is finished, Dr. Carter walks out to the waiting area and tells Krista's husband the good news.
Krista was a champ throughout. She talked to us, she told us about the kids, told us about Halloween. She really did very well. And I think she's going to be actually fine. Really do.
Krista McFadden's brain tumor was benign. She's recovering at home.